It's almost Valentine's Day and everyone thinks the heart is all about romance and love, but sorry to disappoint you, the heart doesn't do any of that. It pumps blood around the body to the lungs and then the cycle continues. In this week-long series, Matters of the Heart, we caught up with prominent heart surgeon and Minister of Health, Dr. Dwayne Sands, to discuss the prevalence in cases, causes, types of conditions in adults, and what you can do to prevent it.
Heart failure is a collection of disorders that leads to your heart not functioning properly. Babies are born with it and others acquire it over time due to infections, cancers, injuries, or bad habits. Heart surgeon and Minister of Health, Dr. Dwayne Sands, says it's something Bahamians everywhere should take very seriously.
When people get heart failure, it speaks to the problem where the pump isn't working efficiently, and so blood backs up in the lungs, or fluid backs up in the body. When the heart beats, it squeezes out about 55 to 65% of the blood that is loaded into the bottom chambers. When that drops to 50 and then 45 and then 40, 30, 20, you get progressively worsening heart failure.
Drinking too much alcohol, obesity, and poisonous substances in your system can also lead to the weakening of heart muscles. Dr. Sands shared with us a number of heart conditions that are quite common.
Coronary artery disease, where you get blockages in the arteries that supply blood to the heart. When that happens, it can lead to chest pain or to a heart attack. One of the most common, very, very common in the Bahamas. Another problem that you can get is problem with the valves in the heart. There are 4 valves inside the heart that keep the blood flowing in the right direction. Some of them can get narrow and some of them can leak.
Throughout the Caribbean, there's a dramatic increase in the amount of deaths from heart disease, and Dr. Sands says it's taking a toll not only on productivity, but the bottom lines of patients and their families.
When you have a problem with the electrical system in your heart, that could be anywhere from 8,000 to 15,000. If you have a problem with the heart rhythm, where you have to have an implantable defibrillator, that can be anywhere from 15,000 to 40,000 for the device. For people that need open heart surgery, that can range anywhere from 40,000 to 100 or 200,000. For people that need a heart transplant, $500,000.
With 24% of all deaths in the Bahamas as a result of heart disease, Dr. Sands says the Bahamians must move into more prevention and wellness rather than cure.
Imagine a 30-year-old who's uninsured facing imminent death unless you can come up with $500,000. You can't cook enough fish or fry enough fritters to raise $500,000. And so again, prevention, prevention, prevention.